Assalamualaikum warahmatullahi wabarakatuh. Today, we are going to present our assignment about infertility. Before we begin the presentation, let us introduce you to our group members. Our group consists of 4 people. First, Sumaya Safrina binti Muhammad Amirul. Second, Siti Sarah binti Muhammad Syaihan. Third, Nur Idina Nabiha binti Muhammad Norawi. And lastly, Nurhana Farisha binti Norizam. Let's move to the introduction of infertility. Infertility is a disease of the male or female reproductive system defined by the failure to achieve a pregnancy after 12 months or more of regular unprotected sexual intercourse. Infertility may occur due to male, female, or unexplained factors. Some causes of infertility are preventable. Treatment of infertility often involve in vitro fertilization, IVF, and other types of medically assisted reproduction. Next, this slide shows fertility rate from 2012 to 2022 in Malaysia. This graph shows a steady decline in the number of children born per woman from 2012 to 2022. One important factor contributing to this trend is the rise in infertility rates. This is a Quranic verse that shows Allah's power on infertility.
أو يزوجهم ذكرانا وإناثا ويجعل من يشاء عقيما إنه عليم قدير.
This verse emphasizes that the outcomes related to children, whether having sons, daughters, both, or none, are entirely in Allah's control. It teaches believers to trust in Allah's wisdom and recognize His supreme authority over all matters of life. Next, let's explore the treatment for infertility. What is in vitro fertilization? In vitro is derived from Latin word that means in glass. In vitro fertilization is a type of fertility treatment where eggs are combined with sperm outside of your body in a lab. Before that, let's explore the history and development of in vitro fertilization. 1970, Patrick Steptoe developed in vitro fertilization to treat fallopian tube injury or obstruction in females who were infertile. This important development in embryo research has made it possible for a lot more people to become pregnant, and as a consequence, their chances of becoming pregnant have considerably risen. After the announcement in 1978 that the world's first test tube baby had been born in United Kingdom, IVF has attracted the attention of the public worldwide. IVF and andrology laboratory technology and clinical procedures have advanced to the point that they have transformed into a medical treatment that is well organized, methodical, secure, easily accessible, and reasonably priced. As of today, more than 5 million babies as a result of IVF had been born.
There are a few risks of in vitro fertilization treatment. For the baby, they tend to have low birth weight, premature birth, and physical health problems. For the mother, they tend to have infection, bleeding, and miscarriage throughout the in vitro fertilization treatment. Let's look into factors that affect outcome of in vitro fertilization treatment. Firstly is age. Success rates were lower in older women compared to younger women. Secondly is previous pregnancy. Previous pregnancy substantially increases the likelihood of success after in vitro fertilization, especially when the previous pregnancy resulted from previous in vitro fertilization treatment and ended in live birth. Now, let's look into cost analysis of in vitro fertilization treatment. The average cost per started in vitro fertilization treatment cycle were €2,381. Next, the cost per ongoing pregnancy were €10,482. All in all, the total cost will be around €12,863. Moving on, let's review the in vitro fertilization procedures. Firstly, the ovaries are stimulated by daily injections of gonadotropins to optimize follicular development, which is monitored by means of transvaginal ultrasonography. Secondly, the same ovary has multiple growing follicles after gonadotropin stimulation. Thirdly, after ovarian stimulation, eggs are retrieved by means of ultrasound-guided transvaginal aspiration of follicular fluid. For the fourth step, a mature human egg is recovered from the aspirated fluid. Next, recovered eggs are often fertilized in vitro by culturing eggs with many motile sperm. Then, multiple sperm are attached to the egg's zona pellucida. Eggs can also be fertilized by means of intracytoplasmic sperm injection, a technique in which a single sperm is injected into the egg with the use of a thin glass pipette. Later on, the technique was developed to facilitate fertilization in cases of male factor infertility, but is now used in a majority of IVF cycles. Multiple embryos are cultured often for 3 days. After that, multiple embryos are cultured often for 5 days. Lastly, selected embryos are transferred back to the uterus. In summary, in vitro fertilization is a complex process with potential risks and varying success rates influenced by numerous factors. The cost can be significant and the procedure involves several stages requiring medical expertise and careful monitoring. Understanding this aspect is crucial for individuals considering this treatment option. The following is a list of references from our presentation.